Hello, welcome to the Fix It video series where I interview people, in this case Ashton Reichman with Accelerate Physical Therapy. The goal of this podcast is to help people get to know real people with real stories who really fix real issues. Because ultimately, no matter what letters are behind our name, and no matter who's insuring us medically or not insuring us medically, it's real people who fix real problems. So, Ashton, thanks for joining me. So, this is Dr. Ashton Reichman. I forgot to mention that. Yeah, Ashton, I've known you for how long now? Has it been
10, almost 10 years.
Has it been 10 years? Okay, yeah. You were my student around then. Yeah, I remember that.
2016.
That was great. Yeah, I didn't know you had a dry sense of humor. I remember.
Not initially.
Yeah, I remember the first 2 days. I was like, is this guy just a real jerk? Or, yeah, but turns out you're really funny.
I was being very professional.
Yes, yeah, you were.
Stoic.
It was good. Yeah, it was really good. So, yeah, so tell us, we'll cut to it. What do you fix? How do you fix it, and why should people trust you to fix it?
So at Accelerate, I help people who are active or who want to be more active fix the pain that's limiting them from participating in the activities they love and the activities that bring them joy and give them the quality of life that they want.
Okay, all right. And how do you do that? Maybe if you want to zone in on like one particular activity or a patient example, how do you do that?
Yeah. It has to start with a thorough history, so you know the patient, so that I know the patient and I know the context in which their pain is limiting them, and what else is going on in life. Maybe there's a lot of stress, or there's a history of injuries that have led to this other thing that they're now dealing with. So a detailed history, a very detailed examination, so we can tease out exactly what's going on. Sometimes, for example, elbow pain is not due to the elbow, it's due to the shoulder or the upper back, dysfunction in how that's moving. And then from there, between the patient and I, we will work together as a team to establish what the plan of care looks like, what they're able to do in terms of how often they're able to complete their exercise program, what they're already doing with exercise. And so synthesize all of that information to develop an individualized plan of care with individualized exercises, because nuance in exercise really matters. So something I think a lot of people, especially the highly active population that is exercising frequently or lifting weights frequently, deals with is upper back, shoulder blade area pain. And sometimes that goes up into the neck, and all of that's connected. And that's probably one of the most common things I see. And that responds really well to dry needling and joint mobilizations. But usually the reason for that is a lack of awareness with precisely how they're performing certain exercises like overhead movements. So that's something that people tend to just deal with and assume that it's just part of being in the gym. Everybody in there is grabbing that shoulder and rubbing it out before the next set. And I want people to know that that's not something that they have to deal with. There's a solution to that.
So can you explain dry needling and joint mobilization in that context with that pain in particular? Just for people who don't know.
Dry needling will help to release tension in areas that have become too tense due to compensation with movement patterns. So if you're not performing your exercises with good form, other muscles might jump in to help complete that movement. And over time, those muscles become chronically overworked, overburdened, and too tense. And we need to release tension from those muscles with the dry needling and develop tension or develop capacity in other muscles, so that moving forward you can continue to complete those workouts without this recurring issue. Joint mobilizations refers to helping specifically in the spine, helping the segments of the spine move appropriately, how they should on one another. Again, if you have if you are too tense in those upper back muscles, they're chronically shortened.
Yeah.
That can cause dysfunction in how those upper back segments, how they move.
Okay, yeah, that makes sense. So, well, you've answered this question a little bit already, but yeah, why should someone trust you? Like, what's maybe the education that you have behind that, the expertise from clinical experience, and then what you enjoy doing?
Yeah. Yeah, you mentioned it at the beginning. It doesn't matter what letters we have behind our name.
Yeah.
From a licensing standpoint, it matters
right.
what letters we have behind our name. Legally, to be a physical therapist, you have to have those letters.
Yeah.
But that's not enough.
Right.
I think it's developing a rapport with the patient so that, the old adage, they don't care how much you know until they know how much you care. And so communicating that, being compassionate during the evaluation, listening actively to what they're telling you, and developing that rapport so they learn that this guy actually cares and he actually wants to help me. And I think it's helpful for people to know that I am very passionate about movement as medicine, and some might even say obsessed to the point that I think my wife tires of hearing me talk about my fascination with some of these things sometimes. Luckily, at the gym that I work at, where Accelerate's located, the gym owner, Vincent, and I both tend toward obsession with movement and performance, and so we can nerd out with each other, and I think spare our wives and our friends some of that
work life.
We can spare our friends from having to listen to us go on soapboxes about movement and rehab and performance and things like that.
Okay. Yeah, that's really good. Thanks, Ashton. I had another question, but I lost it in the midst there. It's gone. Oh well. So well, thank you for joining me. Is there anything else you want to talk about? Oh, that was it. Yeah. In particular, you're out of network with insurances.
Correct.
So what impact does that have on why someone should trust you to take care of their real problem?
Yeah. My motivation for going out of network with insurance was that I had a few cases where you could say I got burned. The patient and I got burned.
Yeah.
Where I wanted a certain plan of care with that patient, and the insurance said no, or that patient filled out their questionnaire that indicated they were at a certain level of function, and so the insurance company said that's good enough. And I don't like good enough. I want people to get to 110%. If you have a recurring issue, getting you back to 100% may not be sufficient to prevent that from happening again. So let's aim for 110%.
Okay.
And so by going out of network with the insurance companies, I have total flexibility and total autonomy. It's just me and the patient deciding what that plan of care should be, as it should be, and not a third party who has had no part in the conversation, is somewhere far away.
No skin in the game.
No skin in the game.
Well, or skin in the game to not.
There's an incentive there for them to put up roadblocks and decrease the amount of care that somebody can get. So being out of network allows me total flexibility to set up plans of care as I see fit, and to make changes on the fly. If somebody's doing really well after the first couple visits, then I can say, let's meet back up in 4 weeks or 6 weeks and do a check-in, and we don't have to do any extra paperwork or there's no insurance stipulations about that appointment being so far out that it's considered a new episode of care.
Got it. Yep. Yeah. It's just, it is continuous because you know them and because you had the time to engage. So Okay. Yeah. Thank you for explaining that, because that's difficult for, well, even if people do have like really good insurance, they still have to consider the cost of like what will I actually get out of this product. So,
correct.
So thanks for
and I think
explaining that.
With my model, I'm able to be one-on-one the whole time, every time. So I tell patients, I will only see you and you will only see me. So there are no assistants or technicians that are participating in the appointments. I'm not delegating treatment to them. I'm there every time for every repetition. And so those nuances of how the previous session went I have those in my mind. I'll document as much as I can, but some of those nuances are
hard to capture.
Hard to capture, So remembering last time, okay, your shoulder liked it when I put you in exactly this position, and that was more effective to release that tension or decrease your pain. Yeah. And that allows each session to be more productive. And so on the whole, you can decrease the number of sessions that you need. And you will get one-on-one individualized attention the whole time, every time.
Okay, yeah, that's really good. Okay, on that note, this is getting outside of the fix-it, but if you were to give an estimate of inflation of physical therapy services in terms of number of visits in the insurance-based model compared to the out-of-network model, what percentage would you estimate that at? So,
well,
based on your experience.
I know there are some statistics that the average plan of care in an outpatient orthopedic clinic is between 8 and 12.
Yeah.
And so far, I've had a lot of success with more like 3 to 6 visits total, which means less time off work, or for athletes, less time out of school, or fewer practices missed, back in the game sooner. There have been a couple cases that are more serious injuries that buck that trend, that I've had longer plans of care. But even then, what's nice is that I can create a program, I can talk to coaches, or I can talk to other trainers and sort of delegate that, hey, this is what we did in our last therapy session. It went really well. Can you incorporate these things in a training session? Or can you hold an athlete out of these drills but have them perform these things instead that are progressive and still directed toward returning to their activity?
We're actually hitting the 110%. That wasn't made up. That was actually changing their ceiling.
Exactly. And so in that case, instead of needing that athlete to come in twice a week, seemingly in perpetuity, to get this injury all the way back, it's once a week to start, and then once every other week. And when things are stable and that athlete through the process of me educating them in every session what the goals are of this exercise, what the intent is behind the exercise. It's not just get the reps done, it's get the reps done this way for this end goal. Then the athlete has a greater understanding of their body and of the rehab process. And so when they're back at their high school weight program or working with their speed coach or their skill coach, they understand why they have this warm-up series, and they understand why I want them to decrease the weight for now on an exercise so that it's performed with better form.
Right. Yeah. And being out of network, you have time to explain all of that when you're with them, instead of thinking like, I got a note that's going to take me a while to finish. I got to worry about working with the insurance.
I'm not worried about notes other than what did the patient say when they got here? What did we do and how did it go? And it's pretty quick and easy. And that also frees me up to have more time to write more detailed instructions for them. So their home exercise plan, rather than just sending, the names of the exercises, I can find a YouTube video that helps communicate the nuances. Or if it's an exercise that is totally unique to them that I can't find anywhere else, I can write out all 10 steps to that exercise. And so, and we can review that before they leave so that they understand what I'm saying with those, with each of those instructions.
Right. Okay. Yeah. So it's not just that you decrease on average the number of visits and potentially the cost with that, but you also are increasing the quality with it as well. So that's really good. Yeah. Thanks, Ashton.
And so I've told people when it is not cost effective,
Mm-hmm.
even if it is not cost effective, it is quality effective.
Yep. Yeah, definitely. Yeah.
And so I would say to people, if you want the highest quality that you can get,
Yeah.
then
Yeah.
Accelerate's your place.
Yep. That's really good. Yeah. Yep. To quote one of my friends, Justin Lewis, guaranteed health insurance is not guaranteed health care. So I really like that quote.
I like that.
Shortly encapsulate it. So, well, thank you, Ashton, very much for coming.
Yeah,
so,
thanks for coming here.
Yeah, like, subscribe, comment. So if you have questions, reach out. So we'd love to answer them. Thank you.
Thank you.